In case you didn't know, high blood pressure is ridiculously common. It seems like when I work in the ER, probably at least half of my patients have it, whether they know it or not, and a lot of them are taking medication for it. And statistics actually back that up. So it's because it is about half of the adults in the United States that have high blood pressure, and only about a quarter of those who have it under control, quote unquote. So in this video, I'm going to give you a rundown of basically everything you need to know about high blood pressure. What causes it, what complications come from it, including deadly complications in some cases, what are the typical treatments that they teach us in PA school or medical school, and how well do those work, and what are some alternative treatments that may be better and more effective. I'll also show you the next steps if you want to get started with using fasting and other lifestyle treatments to fix high blood pressure. So I think this is really going to be valuable if you're someone who either has high blood pressure or if you know somebody with high blood pressure. So I'd recommend you listen all the way to the end. So first, what causes high blood pressure? Clearly, there are multiple things, so it's not ever going to be just one thing, but some of the things are a lot bigger than others in terms of these different factors. So higher stress levels, poor sleep can definitely raise your blood pressure. Sleep, one of the functions of sleep is to help kind of moderate your blood pressure. So if you don't get enough sleep or good quality sleep, you're going to have higher blood pressure. Also, it can be genetic to an extent. It can kind of run in your family. But probably the single biggest cause of high blood pressure is diet. And so in our Western diet, it's actually not even a Western diet now. It's like all around the world. But in our standard American diet, which is, again, not even just an American diet, basically we eat tons of processed food, a lot of sugar and starch, way more than our ancestors did. So as a result, this hormone called insulin that comes from our pancreas is getting pumped out more often and at higher levels than it ever did in the past. And so whenever you have way too much of a hormone, your body says, whoa, that's too much. And it turns down the response. So it has to turn down that response. Like if someone's screaming in your ears and you put earplugs in, it's the same idea. So that's how you get what's called insulin resistance. And insulin resistance is probably the number one cause of high blood pressure. And so that basically results of the type of food we're eating and how often we are eating. So that's probably the biggest cause. Next, let's talk about complications or dangerous things that can happen as a result of high blood pressure. So high blood pressure, also known as hypertension, is sometimes called the silent killer because you have it and you think, no big deal, but then it can cause a lot of catastrophic problems. Potentially. So one of those is heart attacks. If you have high blood pressure, you're definitely at a higher risk of having heart attacks or other heart problems. There's a whole bunch of other heart problems. Also strokes. So various things where your blood vessels get blocked, right? That's what a stroke usually is. That's what heart attack is. Also, the blood vessels in your legs could get blocked. It's called peripheral vascular disease or peripheral arterial disease. So those are a bunch of complications. And then there are other things like when people have kidney failure. High blood pressure is one of the leading causes of that. And so you might end up having to go on dialysis, where you spend several hours multiple times per week having a machine filter out your blood. Another one is vision loss, blindness, can happen as a result of high blood pressure. So as you can tell, if you have your high blood pressure out of control for long enough, it's really not a pretty picture. A lot of terrible things can happen. So what are the typical treatments for high blood pressure? Well, I went to both medical school and PA school. It's a long story. You can go listen to episode 2 of my podcast if you want to hear all about it. But as a result, I know what they teach in both. And that is, there's kind of a series of steps of how you treat high blood pressure. And the first step is always, that you're always taught, is lifestyle changes. So that includes things like they're like, lose weight, exercise, are basically the two things that they would normally say in that context. But what I've learned through experience, through working in the real world in various clinics, et cetera, is that most physicians and other clinicians like myself typically don't really pay much heed to that idea of lifestyle changes. Instead, what they usually do is they skip right to the medication. Now, at the very beginning, when they're first starting their career, maybe they kind of try to emphasize the lifestyle changes. But after a while, they kind of get frustrated and realize that it's not working very well. And so they usually just end up skipping straight to the medications. Now, how do blood pressure medications work? Well, there are several different mechanisms, several different ways that they work, and that includes some of them try to make you pee out more electrolytes and water, so the water kind of comes along with the electrolytes. Some of them try to kind of relax the blood vessels, so they'll open up the blood vessels a little bit more. And sometimes they'll try to kind of slow down your heart, so it's not pumping as hard or as often. And so there's quite a few different ways that they work. But all medications, including blood pressure medications, have potential side effects. And sometimes they're not that uncommon. I mean, they can be uncommon, but it's still, a little bit of a risk to be on them. So I'll give you a couple examples of not so great results of being on blood pressure medications. So some years ago when I was working in the ER, I had a lady come in with low salt, so low sodium in her blood, called hyponatremia. She was sent in by her doctor because they had done a blood test already outside the hospital. But that's a dangerous enough complication that the doctor sent her to the hospital, and then she had to be admitted to the hospital and stay overnight. Now, why was her salt level low? We kind of took a look at the situation, and it seemed like the most likely cause was her blood pressure medicine. I think it was hydrochlorothiazide. That's one of the ones that makes you pee out more water, salt, and other electrolytes. So just being on that medication, it appears that just because she was on that medication, she had to go to the hospital, go to the ER, and stay in the hospital, which is not a harmless thing either. You can have lots of complications just by being in the hospital. Like there's certain infections you're more likely to get if you're in the hospital, for example. Another example of potentially dangerous side effects of blood pressure medicines is something called angioedema. What is that? Well, that's where you get a bunch of swelling, like in your mouth, your tongue, around your neck and your face. And it can happen quite suddenly, and it can make it so you can't breathe, kind of like an allergic reaction, but it's a different type of reaction. And it can happen, people who take a blood pressure medicine called lisinopril or any of the others that are in the same family, ACE inhibitors, are at an increased risk of that. Even years and years later after they stop taking the medicine, they're still at an increased risk of getting that complication. So the blood pressure medications are obviously not harmless. So if the typical treatment, which is medications, is not super duper effective, it's kind of okay, but also has some risks and some potential side effects, is there a better way? Well, yes. I would say lifestyle treatments are both more effective and safer. And one of the best treatments for high blood pressure is fasting. And that's because there's a couple different ways that fasting helps fix high blood pressure. So I'll explain both of those. So the first one is that fasting helps fix something called insulin resistance that I mentioned earlier. So when your insulin is too high, that usually means your blood sugar is too high also. And when you fast, when you're not eating, your blood sugar and your insulin can kind of come back down to normal. So that's why fasting is an effective way to treat high blood sugar and high insulin, also often known as insulin resistance. And by the way, the thing that happens when your insulin's high, your kidneys hold on to more salt and water. And when your insulin is normal, your kidneys function more normally and don't retain as much water. And the more water in your blood vessels, the higher the blood pressure. Just like if you had a pipe and you put more water into it, then the pressure is higher. So same kind of concept. So that's the first big way that fasting helps with blood pressure. Another big way that fasting helps to fix high blood pressure, I heard Dr. Mark Mattson on a podcast recently explaining how intermittent fasting has been shown to increase parasympathetic tone. Now, what is that? That's the part of the nervous system that causes you to relax. So it's sometimes referred to as rest and digest. The opposite side, the sympathetic side, is the fight and flight side of your nervous system. So when you're on the fight and flight side, of course, your blood pressure would be higher. And when you're on the rest and digest side, you're more relaxed. And so fasting does that. And as a result, it's able to lower your resting heart rate and your blood pressure, which is exactly what we're talking about. And also increases heart rate variability, which is a good thing. So in that way, fasting is similar to exercise because exercise basically does those same things as well. So those are two big ways that fasting helps with high blood pressure. And I think fasting is a very effective tool for fixing high blood pressure. Now, sometimes you might hear somebody say that they started fasting and their blood pressure got higher. Well, yeah, in the short term, just like exercise, fasting could raise your blood pressure in the short term. So think about when you're exercising. Obviously, while you're on that treadmill, your heart rate's up and your blood pressure is up. But then a few hours later or a few days later, your blood pressure is probably down and in more of a normal range because of that increased parasympathetic tone and all the other things that come along with it. Well, same idea with fasting. Sometimes on the first day or like while you're in a fast, your blood pressure could be a little higher or it could be lower. I mean, it's a little unpredictable because there's kind of competing forces during the fast, but in the long run, it's probably going to fix it. So a few other things that can also help fix blood pressure, lifestyle-related things, include lowering your stress level. So anything you can do to do that. I mean, I know it's easier said than done, but just kind of living a more peaceful life or avoiding social media or, staying away from some of the conflicts, simplifying your life. So stress management is a big one. Another big one is sleep quality and quantity. So there's actually a certain stage in sleep where one of the things your body's doing is kind of like relaxing your blood vessels. So if you don't get to that stage of sleep, you don't fix your blood pressure, basically. So one of sleep's purposes, one of its various purposes is fixing your blood pressure, oddly enough. So if you get enough sleep and good quality sleep, you're going to probably have more normal blood pressure. Exercise is another one that fixes blood pressure. And it's another useful treatment for it, in other words. And I already explained that. It increases the parasympathetic tone, or at least I alluded to that. So exercise has various benefits and also helps manage your blood sugar and your insulin levels and stuff. So it does some of the same things that fasting does as well. So they're very complementary in that regard. And then sauna, doing some heat therapy has a bunch of cardiovascular benefits. And I believe one of the ones that's been specifically noted is improved blood pressure. But regardless, it has a bunch of like heart and blood vessel related benefits. So it's going to be good for that system overall. So think about how you can make at least some small improvements in some of the areas that I've talked about, and including fasting, because fasting is an effective treatment for high blood pressure in many cases. So if you want to know how to get off on the right foot with fasting, I've got an intermittent fasting checklist you can download, and I'll put a link in the description below. So it kind of covers a lot of troubleshooting to make sure you don't succumb to some of the common pitfalls with fasting. I've also got a video right here that explains the easiest way, perhaps the easiest way to start intermittent fasting for a total beginner. And then I mentioned that fixing high blood pressure is one of the benefits of intermittent fasting, but there are several other health benefits that come from intermittent fasting. So I've got a video here that explains 9 key benefits of intermittent fasting, so you can get a little bit more broad view about all the different benefits that you can potentially get from fasting. Thanks for watching. I'll see you in the next video.